Hi, I'm Bill Osmolsky with the MacIver Institute, and this is your MacIver News Bulletin. The Joint Committee on Finance has begun voting on the next state budget bit by bit. That work will continue over the next few weeks. The first big debate was over an old issue, whether or not to accept the federal Medicaid expansion. Democrats say yes, and Republicans say no. Here's why. Under the Affordable Care Act, the federal government pays 90% of Medicaid costs for states that cover all adults who make up to 138% of the federal poverty rate. Wisconsin is one of the 12 states that hasn't done that expansion. Instead, Wisconsin covers everyone who makes up to 100% of poverty and encourages everyone else to get private plans on the Obamacare exchanges. Depending on your income level and where you live, some of those plans are less than $1 a month. Democrats say that's still too much, and they want those people on Badger Care.
Badger Care expansion means more people can access affordable care, and that is step one.
Republicans say the private plans have higher reimbursement rates for providers than they get from Medicaid. That's important for health care access.
We created a plan in Wisconsin. We've done things, the reinsurance, to help bring down the rates for folks on private health insurance on the exchange, that we know helps our hospitals and doctors get better reimbursement rates and provides access for folks on those health insurance plans to go to those clinics that are associated with those health insurance plans, not end up in emergency rooms like so many of our Medicaid welfare insurance patients do.
The nonpartisan Legislative Fiscal Bureau says the more people on Medicaid, the less likely providers are to accept Medicaid patients at all. In other words, more people on Medicaid means lower health care access. Even Democrats admit Wisconsin has better health care access than states that agreed to expand Medicaid.
No state has copied us. And why didn't any state copy us? Because it's a bad deal. We covered more people, but we didn't draw down the federal revenue.
He acknowledged, the quote, I wrote it down, we covered more people. We did. We agree. Glad to hear you say it. But then the next thing was what struck me as the difference. But we're not taking all this federal money. So folks, the real problem isn't access to health insurance. The problem is that we won't put people on a government welfare program to do it.
Democrats argue that federal money is no trifle amount, $1.6 billion over the next 2 years.
It's our money. It should come back here. There are no strings attached to that $1 billion, with the exception of expanding Medicaid.
Republicans say Democrats' obsession with that money means they don't really care about health care access. They only care about expanding government.
His problem is not a lack of access. We've set that up in Wisconsin. Problem is we won't put people on government assistance because we see there's a private sector plan available, and we should be utilizing that.
The Joint Committee on Finance voted to not expand Medicaid in Wisconsin on a partisan 12-4 vote. Republican state lawmakers continue to push election reform. The Assembly recently held a hearing on a bill that would allow election observers within 3 feet of poll workers. Supporters say there's no point in having observers if they're kept too far away to see anything. Democrats say, but COVID.
We have guidelines that say, let's try to stay 6 feet apart for public health. And now every voter has to be at risk of somebody who may or may not be wearing a mask or adhering by other public health requirements getting within 3 feet of them.
But the fact that there's a plastic barrier there, why not let the observers get as close as they need to be? They can't physically interfere. They can't infect somebody.
Ultimately, Democrats not only oppose new election laws, they insist the current laws should not be enforced in most cases.
If you make a very minor error that doesn't really cast any doubt on whether you're a legitimate voter and this is your legitimate vote, then we should do everything possible to try to count that vote.
During a Senate hearing, Matt Rothschild from the Wisconsin Democracy Campaign claimed Republicans are being sore losers over the 2020 election.
This effort is reinforcing a pernicious lie all across the country and feeding a dangerous mass delusion all across the country about the legitimacy of the Biden presidency and about the legitimacy of our electoral process. And this is corroding the very cornerstone of our democracy. You're playing with fire here.
Rothschild was speaking against bills that would clarify who is allowed to collect absentee ballots from voters, where those ballots can be collected, what it means to be an indefinitely confined voter, and what clerks should do with incomplete absentee ballots. Senator Darling explained it's the legislature's job to write election laws, and the role COVID-19 played in disrupting the 2020 election revealed the need for clarification on these issues.
I really resent personally, I must tell you, the idea that we're perpetuating, and our purpose is to perpetuate the lie. We had many people come to us and say, we think these laws are unclear and you need to clarify and codify some of the procedures, and that's what we're trying to do.
Both the Senate and Assembly have introduced about a dozen election bills each, but none have been passed and sent to Governor Evers as of Friday, May 7th. COVID-19 is not only creating problems with elections, it's also putting Americans' individual rights at risk. Mandatory vaccinations and vaccine passports might be illegal for the government to impose on individuals, but liberals say private companies can do whatever they want. That's why Assembly Republicans introduced 3 bills to fix that. You would not need to prove you're vaccinated to go shopping under AB 299. Stores could not discriminate against you for not being vaccinated under AB 303. And your boss could not require you to get the vaccine under AB 309. The legislature has already passed several bills to protect people's constitutional rights during COVID-19, but Governor Evers vetoed all of them. Those included bills that would have prevented government officials from shutting down churches and forcing people to get vaccinated. Meanwhile, COVID-19 levels in Wisconsin remain low. Cases, hospitalizations, and deaths have all dropped about 90% since the peak late last year. Only 3.3% of tests are currently coming back positive. As for vaccinations, less than half of Wisconsin residents have received at least one COVID-19 shot. About a third are fully vaccinated. Be sure to check out our continuing budget coverage and a lot of other important reports at www.MacIverInstitute.com. And be sure to visit us on Facebook, Twitter, and YouTube. For the MacIver Institute, I'm Bill Osmolsky, and this has been your MacIver News Bulletin.